Do fillers really dissolve? MRI studies reveal the truth. Many people are told that dermal fillers dissolve within 6 to 12 months. But newer imaging studies are showing something quite surprising. In some patients, hyaluronic acid fillers can still be detected years after injection. So what actually happens to filler inside the face? And why do some people develop swelling long after treatment? What patients are usually told? Most hyaluronic acid fillers are marketed as temporary. Patients are commonly told that the product lasts somewhere between 6 and 12 months. The idea is that the body gradually breaks down the hyaluronic acid over time. Because of this, many people assume that filler simply disappears once that time period has passed. But in reality, the biology is more complex. Longevity depends on several factors, including the type of filler used, the location of injection, the patient's metabolism, and how the filler interacts with surrounding tissues. What imaging studies show? In recent years, MRI studies have been able to detect hyaluronic acid filler in the face. These studies show that filler can sometimes remain visible much longer than expected. In some cases, filler has been detected several years after treatment. This doesn't necessarily mean that the filler remains exactly as it was originally injected. Instead, it may slowly change shape, redistribute, or integrate with surrounding tissues. This helps explain why some patients still show signs of filler even long after the expected duration. It also explains why correction procedures with hyaluronidase are sometimes required years later. In clinical practice, this can sometimes create confusion. A patient may return several years after treatment believing that all previous filler has disappeared. However, imaging may still show small residual pockets of hyaluronic acid. These residual areas may not always be visible externally, but they can sometimes contribute to swelling, contour irregularities, or asymmetry. This is one reason why clinicians occasionally perform hyaluronidase treatment even many years after the original injection. Why filler can persist? There are several reasons why filler may persist longer than expected. First, modern fillers are highly cross-linked. Cross-linking stabilizes the hyaluronic acid structure and slows down the rate of breakdown. Second, some anatomical areas have very limited movement. For example, filler placed deeply along bone may remain relatively stable. Third, the body does not always dissolve filler in a uniform way. Instead, the filler may gradually fragment and integrate with surrounding tissues. This means that even small residual amounts may remain detectable for long periods of time. Different filler products also vary in their degree of cross-linking. Some formulations are designed to be softer and break down more quickly. Others are engineered to maintain structure for longer periods of time. This variation can influence how long filler remains detectable within the tissue. Why swelling can occur years later? Another interesting issue is delayed swelling. Hyaluronic acid is highly hydrophilic, which means it attracts water. Even small amounts of filler can draw fluid into the surrounding tissue. In certain anatomical areas, such as the lower eyelid, this can lead to intermittent swelling. Several mechanisms have been proposed to explain this. These include disruption of lymphatic drainage, filler located above septal structures, or low-grade inflammatory reactions. Because of these factors, swelling may sometimes appear months or even years after the original injection. One of the reasons imaging studies are important is that they help clinicians understand what is actually happening beneath the skin. Technologies such as ultrasound and MRI allow doctors to identify the location of residual filler, detect migration, and guide treatment if complications occur. This has become an increasingly valuable tool in managing complex filler cases. Key takeaway. So the idea that filler simply dissolves within 6 to 12 months is not always accurate. In many cases, filler does gradually break down. But in some patients, residual filler can remain longer than expected. This highlights the importance of careful patient assessment and good anatomical understanding when performing filler treatments. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. If you found this helpful, please like the video, leave a comment below, and subscribe for more evidence-based content on aesthetic medicine.